Hey, good afternoon and welcome to the last of the 2022 lunchtime learning sessions from us here at ThermaVein. Welcome so much and thanks for joining us. For those that you have had the Zoom link live, thanks for joining us. In your option, you can press the chat function, and if you've got any questions or queries that you want to ask as we're going along, feel free, send that and we get that live in the studio. For those of you who are watching on the social media feeds, the ones that have had the links, please feel free to send us any questions you've got. Send those through to info, that's info @thermavein.com, and they'll try and bring them into the studio and we'll get those as we go along. At the end of today's session, we're going to hold a very quick question and answer event. So if we don't cover something that you'd hope we would, we can try and add it on to the end. Everyone that sent in questions in advance, thank you so much. I've got a little note of them in front of me and we'll try and incorporate those as we go. Anyone having any technical difficulties, again, just email it in or go onto the chat function. Right, let's get on with it. Today we're talking and looking at a quick overview of different options for treating red noses. I think that was the Christmas thing they wanted Santa's nose. So we're going to be looking at facial veins, facial redness. Highly common and often found by patients just to be aesthetically unpleasing. So unsightly, unpleasing tends to be the most common thing we say. Not many people have a medical condition with them, but we do need to understand, why do patients get facial veins? And really it's quite important to try and understand two different factors. Some people will have an underlying issue and some people have a non-underlying issue. And it's really important, if you can, in the early days, to work out the difference between the two. So if somebody's got underlying issues, it's always crucial to tackle those first. If somebody's got a non-underlying vein, it's much easier to go through, and we'll go through that things. But really, from an aesthetic point of view, we want to look at what different options clients have. And the first one that's the most common go-to, believe it or not, for clients is makeup. So people typically have redness or veins on their face, and they most typically go to makeup. It's the cover-up that goes to it. So it's really important that we understand that this can actually be a big part of the problem if somebody has an underlying condition such as rosacea or one of the underlying issues. So makeup can play a part of it. We get a lot of questions about rosacea and makeup and how you combine that in treatments. So what we've actually launched is a simple 1 hour understanding rosacea package. Never going to get through it in this little session. So if you do want to do a little bit more on rosacea, we do this 1 hour understanding rosacea package. If you do want more information, just get in touch with the admin team and they'll arrange to get that booked in for you. But it goes without saying, makeup covers the problem. It doesn't typically resolve the underlying issue. It covers the problem, and in some cases can make it worse when they have an underlying condition. Over the many years, we've seen different types of creams advertised on the internet that claim to reduce or remove the visual appearance of veins. And that's really without any long-term success or results. Some claim to just empty the blood, and they tend to be a little bit more successful if they're going down the route of vasoconstriction, just getting rid of the blood from the area, but they're very, very temporary. We've also seen creams that seem to want to repair broken capillaries. We don't really understand what a broken capillary is, but they want to repair them, and we've never seen any results. So the thing of a client being able to go on the internet, buy a cream, put it on some thread vein or spider vein telangiectasia on their face, and over a period of time that reduce, we haven't seen any benefit. So makeup's great for covering the area. It can be part of the underlying problem, but in general, it's not going to answer any of the problems that the patient has. So that's kind of the makeup side of things. The next one we want to come to, the most common one, and I think it's used a lot specifically within Europe, is the IPL. So IPL is a light-based system using nanometers to treat veins or background redness. And having used IPL for a number of years, having worked with hundreds of clinics that use IPL, I can tell you that IPL gets really good results on background redness, if it's used correctly. So, you know, you've got to be at the right end of the nanometers, you've got to have the right skin type, and you've got to have the right conditions, and you've got to diagnose the right condition. So if somebody has an underlying condition, rosacea is probably the most common one, then IPL, used in conjunction with something to unblock the skin and used in conjunction with something to treat the veins, usually gets very, very good results on the background redness. IPL's specifically for the face, with somebody with an underlying condition that's creating a background redness, is hugely beneficial. We see lots of benefit to that. It's certainly not so good for standalone veins. So we wouldn't really consider using it in lower limb veins, but we're here to talk about face veins. But what we're talking about is veins that are not caused by an underlying issue. So say, for example, someone's caused a trauma vein, they've got some type of allergies, they're blowing their nose a lot, they've got nice prominent veins on the side of their nose. We wouldn't typically see great results with IPL because they don't have an underlying cause. When somebody has, like we talked about before, rosacea, much better results on the background redness, uses a course of treatments and to go down. What you've got to be careful of is that you follow the instructions of the manufacturer incredibly carefully. Make sure you understand the skin types, and please don't be afraid when someone says about diagnosing the Fitzpatrick skin type or working out the Fitzpatrick skin type. Feel free to challenge if you don't understand how to do that, because it's such a critical key point and it's not an actual easy process to do. So IPL, really good results for background redness if used correctly, and to be honest, a lot of our clinics use it in conjunction with ThermaVein in the face, not for the legs, and it's not so good for standalone veins. How does it work? Well, we believe that the IPL targets the underlying problem, which is the blockage of the sebaceous glands and the low-grade infection of the sebum. The energy from the IPL is absorbed into the sebum, and it helps turn the triglyceride a little bit more runny, so it helps it leave the skin. That's why it's quite good to use with a block remover. And it also is very, very good at helping to neutralise the low-grade infection or the underlying irritant of it. Does it work directly for coagulating the blood in the veins? No. We think even at 400 nanometers, it doesn't really get that result so well. And that's demonstrated if you were to use it on a vein where there isn't an underlying issue, and we don't see such typical results. So IPL there. And then we're going to move on to lasers. So IPL is one option, and IPL and laser often get very, very confused. I think the marketing's quite difficult for people to work out sometimes. But laser is separate to IPL, as a lot of you will know. So laser works very differently. So you fire an energy either at the skin, so it goes onto the surface skin, or quite often we hear it where people say that it's endovenous. So that means that they're actually putting a tube or a cable into the body. So endovenous is used specifically on lower limb veins, and you shouldn't take that data across the face veins. It's not really how we use it. So laser is used by energy being passed through into the skin. The energy is absorbed by the blood, and it causes the blood to coagulate within the tube. So the tube stays as a solid structure, the energy of the blood is heated up and it causes it to coagulate. And then it really depends on how you're using your laser. And a lot of clinics have learnt to turn lasers down slightly, so we only coagulate the blood in the tube, but we don't do anything else. So the problem with that is that you get recurrence, because a lot of the time the blood will start to flow again and the vein will refill. Okay. The other way you can use the laser is to pass the energy into the tube, and it rapidly expands the blood and it damages the vein wall lining. So the vein is actually damaged by the blood rapidly expanding. It causes some damage to the vein wall lining, and therefore you get a much longer term result. However, you're using a lot of energy that causes trauma, and this is why we see people that say afterwards, oh, I got bruising, or it looked like I've been in a boxing match. That's because we're bursting the vein to destroy it. Works very well at destroying the vein, but the trauma can cause other veins. So endovenous is when we use the laser inside, so either endovenous laser therapy or EVRF, endovenous radiofrequency, not relevant to what we're talking about today. The reason I'm bringing that up is a lot of people actually ask us questions about endovenous treatments thinking that's what they're going to be applying on the face. I will typically say that I think IPL is, as long as you use it in conjunction with the manufacturer's settings, it's quite low risk. You've got risks of hyper and hypopigmentation, but used correctly, it's fairly low risk. I think lasers, you definitely need to be a little bit more aware at, and certainly there's a higher learning curve. And most of the laser therapists that I talk to say experience is really what teaches them, how to work. And then after that, the most common one that ThermaVein or thermocoagulation gets confused with is electrolysis or diathermy. So just want to cover those off. So ThermaVein uses a 4 megahertz current. The next one over that is a blend technology, which is a little bit debatable. And then after that, we've got a 27 megahertz energy. So anything that uses 27 megahertz, we class that as electrolysis. And when you go up to 60 megahertz, we class that as diathermy or hyphication. So how do they work? Let's start at the 60 megahertz end. So we take a diathermy, been around for years, widely used procedure, excellent for cutting the skin. So it's used quite often with a flat needle to cut off fibromas or skin tags from the skin. Also used for coagulating blood during surgery. Very, very common, used a lot, very, very good devices. But they use very, very high energy. So for treating small aesthetic veins on the face, no. You're going to get burns, you're going to get the risk of marking the skin. Genuinely tends to be too much energy. So after that, come down into the middle, which is electrolysis. And there's a lot of people think that electrolysis is the same as thermocoagulation. So hopefully we'll cover that off now. So electrolysis is designed for hair removal. I've kind of done mine naturally now over the years. But electrolysis is done for hair removal. That's what it's approved for. But there's also, as many of you know, advanced electrolysis. These aren't, as far as we're aware, differences in technologies or machines. They're in relation to the practitioner's training in how to use them. So advanced tends to be about the training that you receive, not the device. So the device pretty much stays the same. 27 megahertz goes into the blood, releases an electric current, and attempts to coagulate the blood within the tube. So uses more energy than ThermaVein. It's about seven and a bit times more powerful than ThermaVein or thermocoagulation, but it's attempting to coagulate the blood within the tube. It doesn't affect or doesn't attack the tube wall lining. So electrolysis, the energy is absorbed by the blood, and the electrolysis tries to coagulate the blood. And it works and it doesn't work depending on how much blood is really going through the vein, how accurate the operator is. And what we do know is that if you're going to treat using these type of techniques, it's really beneficial to use some type of visualization system. As you know, we tend to use the V300s or the V900s. They're very expensive from the Cyrus range. But there are some other good things that you can use now which are a bit cheaper. We've started using quite often the handheld dermatoscopes. And although, I work for ThermaVein, I genuinely believe that by using a handheld dermatoscope for any of the procedures that use needle-based treatments, gives you the accuracy to ensure that you've closed off the whole vein. And I think the biggest, most important part is to make sure you close the whole vein, starting from the very small part down to the feeder, and make sure the whole area is closed, because that gives it the maximum amount of chance to be successful long term. Closing the vein for a short period of time is quite easy to do, but getting results at 6 weeks, 4 to 6 weeks, is really when you get to know whether you've destroyed the vein. So before I start rambling, electrolysis comes down, sends an energy into the blood absorbs the energy, splits the Na positive and OH minuses, causes an electrical coagulation within there. It will work if the blockage stays longer than the vein takes to die. The problem with that is when blood coagulates within the body, the natural healing process is to break it down and the blood flows to start to go again. So recurrence from electrolysis is very high. The other thing is that most electrolysis devices don't use insulated needles, and therefore you can actually cut the skin with it. So when you do your advanced electrolysis training, they'll teach you to hold a skin tag and sort of stroke away at it. It's because it's not powerful enough to cut in one go, so it kind of just cuts a little bit at a time. when you put the needle into the skin, if you don't have the needle being held absolutely still, any pressure to the left or right when you press the button on the pen or whatever can mark or scar the skin. And that tends to be why you get the little bits of marks when you do it, or the little bit of puff that comes off the skin. That's quite common. The other thing that we really believe is it's crucial how you prepare the skin, whether you're using any needle-based device. Really, really important. I haven't got time to go into it today. And in fact, it's not the most scientific outcome, but we do think if you use alcohol on the skin beforehand, any needle-based device, it does limit the results. One, because you get vasoconstriction to telangiectasia, takes the blood away from the area you're trying to treat, but also increases the risk of tenting. This is where the needle sticks to the skin. Any of you that have been on the training courses with us know I harp on about it loads, and I know the other trainers do as well. So electrolysis is about coagulating blood within the vein as opposed to what ThermaVein does. So let's move on to what ThermaVein does. So ThermaVein works by surgically sealing the vein. So as opposed to actually treating the protein in the vein wall to stick the two sides together. And that's why ThermaVein is unique. So the fact we don't treat the blood, so IPL, laser, electrolysis, all are about treating the blood. What ThermaVein's attempting to do is to surgically seal the vein. So we put enough pressure on the vein to push the blood out the way beforehand. That's kind of what you have to learn in the training session. Press the foot pedal and it heats up the protein in the vein wall and it sticks the two sides together. So that's really the difference in the two. If the technology is working, hopefully you can see on the telly behind us. How it works, same as electrolysis. ThermaVein uses a tiny little needle, little probe, bend it to about 45 degrees, 90 degrees, depending on how you hold the pen. Blanch the vein just by applying pressure to the surface of the skin. Press the foot pedal down. That sticks the vein wall together, and therefore the blood can't run up the tube. Instant results, so people look at their nose after the treatment, have a look at it, and the vein will be gone. But like with all these things, it's good to get the wow effect. It's what the patients like. It's what gets us all the great photographs. But looking at the work 4 to 6 weeks down the line is when you know that that vein's been destroyed. And that brings me back to where we started. Because if the person has an underlying issue, so if the underlying issue is, say, for example, rosacea, it's always going to be a ongoing treatment. Is going to be a chronic condition that you have to manage as experts in your clinic, tackling not only the makeup cycle, the benefits of IPL, how to unblock the sebaceous gland, but to get rid of the telangiectasia or thread veins or spider veins that have been associated with that underlying condition. And actually, we train very heavily that it's much, much better when possible, or where possible, to deal with the underlying problem first and then go in and take away the vein. If they've just got veins, just go straight in and take away the veins. So we see this a lot with people that have allergies, hay fever, that's probably one of the most common. They're blowing their nose all summer. They develop these lovely, beautiful veins. Well, I think they're beautiful. We develop these lovely, beautiful veins on the side of the nose. We come in, we do the treatment. We get rid of them, but we hold them on a database and we invite them to come back in the fall every year and just have a top-up treatment because it keeps on top of it. Veins are naturally living things. Patients often say to us, how do I get a total clearance? How do I just 100% get rid of veins? And we always say, we can kill veins, but we can't stop you growing new ones. And that kind of helps manage the expectations. If anyone's got any questions and they want to put them in the chat that we haven't covered, we'll do that. I'm just going to cover a couple of the questions that have been sent in previously, and if not, I've done it in 20 minutes, which is quite good for me. So one of the questions that we were asked is, what's the difference between an air-cooled IPL and a water-cooled IPL? And it's really as simple as this. It's how the head is cooled, because what you don't want to do is cause any damage at the surface of the skin. For those of you who have been to the training centre here, you know that we benefit from using water-cooled IPL systems, but I hear great results off both. I think both have pretty good technologies. We just personally use the water one, so I just wanted to cover that off. We don't use the IPL for anything lower limb. So anything that's lower limb, we only use thermocoagulation, which we get great results on the very small veins, specifically the veins that you can't inject for sclerotherapy. So there was that. Patients that come in with big, simple veins, people often say, how big can ThermaVein treat? What's the biggest vein ThermaVein can treat? And it's kind of the wrong way round is the question, as though the machine will know. The bigger the red vein, the easier it is to treat because the target is much bigger, it's much easier to get the seal. It's the small little veins that become the harder veins to treat, and that's why combination approaches on those actually tends to work quite well because it's typically people with underlying conditions have the very, very small veins, and by dealing with the underlying conditions you can remove a huge number of those first and then very simply go in with ThermaVein and do it. Why does ThermaVein typically work once, or just using it once as opposed to some of the other technologies? Hopefully I covered that one. Stephanie, thanks for asking it. It's because we surgically seal the vein. So when we take the needle and we push down on the surface of the skin, we push the blood out the tube and we stick the vein wall together. We're not in the lap of the gods as to whether or not the blood will remain coagulated. We surgically seal the vein. We just wait for the patient to break the vein down. That was it. The other one that we were asked about is the running costs of having devices. And yeah, every manufacturer is different. ThermaVein doesn't specifically have an ongoing running cost because we just use a tiny little element. We throw it away at the end, we put it in a Sharps box, and then we just reload it. They cost less than £1 each. We are of the opinion that if you do have a light-based system, the IPL or the lasers, like the ones we use here, that you get them maintained and serviced regularly. And most responsible manufacturers will automatically supply that servicing. It really is important to keep them serviced, make sure the heads are functioning, and make sure you've got a good understanding of what you're doing. That's the only tip I could give on that one. And the difference, the last one was the difference between if you're using diathermy and thermocoagulation. Hopefully I did that. In fact, a little slide that I haven't used for quite a while. Hopefully this will help actually bring it up. There we go. So it's all about really the risks of scarring. And when we talk about scarring, we're not talking about huge scarring. We talk about leaving marks, typical results and the risk of burning. And really it's about understanding the more energy that you use. So the higher the energy, the higher the risk. The lower the energy, the lower the risk. That's just the nature of the beast. So we always want to use the least amount of intervention to get the best possible results, hence why we only use a maximum of 4 megahertz, we only do it in 15 minutes, and we do it in small intervals to get there, as opposed to maybe using high energy and doing it slightly differently for lower limbs, because we automatically go to sclerotherapy for big veins. But on the face, people have only got one face, so let's go gentle, let's get the veins sealed, let's do it in a very methodical way. We don't like to go to high energy sources at all. There was that one. And then the last one we were asked was about treating red noses inside the nose. It's easy to do. I think it's easier for the operator than it is for the patient, because having these veins treated inside your nose may be a little unfair because I'm not particularly great with pain. It definitely makes your eyes water, makes you sneeze, but they are by the nature of the beast the easiest veins to treat. And the only tip that I could give to that is just to pinch the nose. So literally hold the nose, give it a bit of a pinch and a bit of a twist. It kind of activates a lot of the nerve endings, takes away some of the sensation. We don't recommend that you use any type of pain relief, LMX, EMLA, ice or anything like that on the skin beforehand, because it could interfere with the treatment. A lot of these things cause vasoconstriction, so the blood's no longer in the area, and we need to see the blood to be able to do the treatment. There you go, guys. Hopefully I've answered the questions. If anyone's watching on the social media feeds and they do have any questions that we haven't answered, please feel free to send them in to info@thermavein.com or give us a call. For everyone that's joined us live on Zoom and watching live, thank you so much. Take this opportunity to wish you all the very best for the new year. Wish you a healthy and happy new year. Hopefully I didn't talk too fast. Please feel free to contact us if you've got any questions we didn't answer. We've got the ability to do live one-to-one Zooms, so we're more than happy to do that over the next few hours or weeks. And that's all to be said. Have a very, very happy Christmas, and we look forward to seeing you all soon. Take care, guys. Bye.